So you've been to your doctor, you got some lab work, and you told everything looks normal, but you're exhausted, you gain weight that you can't lose, your energy is gone, your sex drive has disappeared, and you feel like you're just declining slowly year after year. And every time you bring it up, you walk out with another prescription. I'm here to tell you that that's not healthcare. That's disease management, and there's a profound difference between the two. This is Iconocast. My name is Chris Potter, and I'm going to challenge everything you've been told about how medicine is supposed to work. Now, before we get into the science and have conversations about this, I want to tell you who I am and why I'm qualified to say what I am about to say. It's because the space is full of opinions and noise, and credentials matter. I started my career early on. Right out of high school, I became an EMT and then a paramedic shortly thereafter. I worked the streets and in ambulances primarily for the beginning of my career. I saw what happens when the medical system fails people, when they've ignored symptoms for years because they were told everything was within normal limits. And then they're calling 911 in a crisis. I saw the end result of the system focused on a reaction rather than prevention. This experience drove me into nursing. I spent years working in emergency departments and trauma centers where I saw the full spectrum of human illness: strokes, heart attacks, metabolic collapse, obesity-related disease, conditions that in many cases were preventable. Not with more medication, but with earlier, smarter intervention. I went on to become a nurse practitioner. I practiced hospital medicine, meaning I managed some of the sickest patients in the healthcare system. I know what acute illness looks like, and I know what happens when underlying causes are never addressed. As I walk through the halls, the reality is most patients are not in there because of car accidents or gunshot wounds or something that had happened to them. The vast majority of the patients that are in the hospital are there for metabolic disorders that could have been prevented early on with lifestyle modification. I also hold a master's degree, and my thesis was focused on weight loss because nutrition is the basis of this. Specifically, why traditional approaches fail and what evidence actually tells us about sustainable fat loss. I published a book called Small Changes for Big Weight Loss. I am the founder of Eros Vitality, a men's and women's health and wellness practice in Sarasota, Florida, where we specialize in hormone optimization, sexual health, medical weight loss, personalized diagnostics, longevity, and peptide education. I am not an outsider criticizing medicine from the cheap seats. I live inside the system every day. I know its strengths, and I know exactly where it breaks down, and I want to talk about it honestly. Let's start with the question that most people never thought to ask. What is your primary care doctor actually trying to do? If you ask most people, they'll say, trying to keep me healthy, but that is not what the system is designed to do. The system is designed to treat disease once it is already present, and to keep chronic illness from killing you too fast. And the research is actually pretty clear on this. We are spending more and getting less because we are treating symptoms rather than causes. Here's the model your PCP works within. You come in once a year, they run a basic panel: CBC, BMP, blood sugar, cholesterol, maybe a thyroid screen. They compare your results to population reference ranges, and if you fall within a reference range, you're normal. You fall outside, you get a prescription. You're tired in your 40s because you're getting older. You've gained 20 pounds because your metabolism is slowing down. You don't feel like yourself anymore, but your labs are normal. So the assumption is you're fine. I want you to understand something clearly. Slow decline is not inevitable. A sufficient portion of what we call aging is not chronological age. It's hormonal decline, metabolic dysfunction, nutritional deficiency, and inadequate recovery. These are addressable. The research on this is not fringe science. A study published in The Lancet demonstrated that sarcopenia, the loss of muscle mass with age, accelerates dramatically after 40 and is directly correlated with declining anabolic hormone levels, including testosterone and growth hormone. This isn't just a cosmetic problem. The loss of lean muscle mass is an independent predictor of all-cause mortality. This podcast is called Iconocast because an iconoclast is someone who challenges accepted beliefs, questions the sacred cows, who demands better evidence, who refuses to accept the status quo just because it's familiar. That's what we're going to do here every episode. We're going to talk about what research actually says, not what the guidelines say, not what's convenient for a 15-minute visit, but what the peer-reviewed literature tells us how to actually manage and optimize human health. In future episodes, we're going to go deep on hormone optimization for both men and women, the difference between pharmaceutical and bioidentical hormone therapy, and what the evidence tells us about the real risks and benefits. We're going to be discussing peptides. We're going to discuss medical weight loss, not the diet industry nonsense, but what the science actually tells us about why people can't lose weight and keep it off, and what interventions, including GLP agonists and the non-GLP-1 options that we use at Eros Vitality, actually work long-term. We're going to discuss diagnostic testing because, frankly, the standard annual panel is frankly inadequate, and we'll talk about the markers that actually matter and what you should be asking your provider to check, and how to interpret your own results. All of these topics connect directly to work we do here at Eros Vitality, which you can learn more about at www.erosvitality.com. We are based in Sarasota, Florida, but we work with patients throughout Florida and beyond through telehealth. I want to be clear about something. This podcast is educational. It is not a substitute for individualized medical care. The goal here is to give you the knowledge to ask better questions and demand better answers and take more active role in your own health, because nobody is going to advocate for your optimization the way you can if you know what to look for. Let me leave you with this. In 2023, the American Journal of Preventive Medicine published a study showing that despite decades of advances in pharmaceuticals and surgical intervention, Americans are spending more years in poor health than ever before, meaning we are living longer, but not better. Life expectancy is going up. Health span, the years we spend feeling vital, functional as well, are not keeping pace. That is the mission here. Not just more years, but better years. The current model will not get you there, but the evidence-based tools exist. The science is clear. The question is whether anyone takes the time to apply it to you specifically, individually, with your labs, your history, and your goals in front of them. That is what we do here at Eros Vitality, and that is what we are going to talk about every episode on Iconocast. Thank you for listening. If this resonated with you, share it with somebody who needs to hear it. Subscribe wherever you get your podcasts, and if you're ready to stop managing your decline and start optimizing your health, visit us at erosvitality.com. I am Chris Potter. This is Iconocast, and we're just getting started.